Welcome to Mental Health Moments. We'll take a moment of your time to share mental health news and information we hope will empower you and your family to get on or stay on a journey towards wellness, mind, body, spirit, and soul. The Mental Health Moments team is excited to bring you an interview with Dr. Ina Ramos. Dr. Ramos serves as the Director of Programs and Finance for the Maryland Center at Bowie State University. She also has more than 15 years of experience in behavioral, community, and academia in the field of public health, focusing on community health initiatives, health disparities, and program planning and evaluation. Dr. Ramos will share information with us about the tobacco education and prevention program in the county, of which the Youth Services Bureau is a part. Before we get to the interview, I want to share what the District Heights Family Youth Services Bureau is serving up for you. If your child needed CPR, could you perform it? According to everydayhealth.com, 85% of cardiac arrests take place at home. The Youth Services Bureau is getting prepared. We want you and your family to be prepared as well. Join us for CPR and First Aid certification training on February 26th from noon to 3 p.m. Call the office to register at 301-336-7600. 80% of cardiac events may be prevented. Together, we can make a difference. The Maryland Coalition of Families Youth Advisory Council meets in the Municipal Center on the third Friday of each month. A YSB clinician shares mental behavioral health information with youth as they plan programs and events designed to assist their peers with struggles or stressors that could derail their progress. If you believe your teen is ready to help or be helped, call us at the office or email smathis, that's M-A-T-H-I-S, smathis @mdcoalition.org. The City of District Heights, the Youth Services Bureau, and the Youth Development Foundation wants to partner with you to host its first Family Health Fair with men in mind. The health fair is June 30th and will be hosted here in the city. If you'd like to assist us in the planning, or if you'd like to participate as a vendor, a speaker, or class facilitator, call us as soon as possible. The number again is 301-336-7600. The YSB will be at Kettering Baptist Church in early March to present a topic on social media and sex trafficking. If you'd like to be a part of the audience, call 301-627-9500, extension 1. Our clinicians often provide training to community organizations on an array of topics to include the 3-hour, 6-hour, or 12-hour active parenting course. The Your Life Matters program will host its last college tour and workshop for the school year on April 6th. The tour will go to the University of DC, and the workshop is called Money Matters. You'll want to bring money for lunch, but dinner is on us. Call the office to register. The YSB has been a part of the Tobacco Education and Prevention Program since 2016. We typically provide education and prevention information through lectures, hands-on nutrition activities, and time with a professional trainer. Last year, we ended our week-long program with a 2-mile run. So let's get ready to meet Dr. Ramos and learn how she's able to reach the entire county through the Maryland Center at Bowie State University. Hi, Dr. Ramos.
Hello.
Thank you for meeting with me today and sharing how your agency serves Prince George's County through its Tobacco Education and Prevention Program.
Thank you for having me.
So let's get right into it.
Okay.
Can you give us a little bit of the history of the Tobacco Education and Prevention Program and how many years it's been in existence here in the county?
Okay, sure. So in 1999, the Cigarette Restitution Fund program was established when the Master Settlement Agreement occurred between Big Tobacco and the U.S. government. The state of Maryland decided to dedicate some funds towards prevention, education around tobacco use directly for the community.
Okay, wow, so that sounds like and is a great opportunity for the state of Maryland and its residents.
Definitely.
So how did the Maryland Center and Bowie State University become a part of the program?
Okay, so the Maryland Center, we were also founded in 1999, and the center staff, our executive director Terry Lala, and our board, they had a feeling that the settlement was going to be coming, and they alerted the governor's office. And so once the state of Maryland settled, the Maryland Center was perfectly poised and ready to conduct outreach and education around tobacco use.
Well, that's great. It sounds like you all were, I mean, in addition to being poised, you were prepared, you were ready, and you were in a position, I mean, you had forecasted what was about to happen.
Yeah, so we were one of 2 organizations or vendors that were funded to do tobacco prevention and outreach in the state of Maryland originally, and then it expanded to the majority of the counties in the state.
Okay.
Yeah.
How many different organizations are a part of the program itself?
Well, I'll say in our 20-year history, we've funded directly upwards of 50 community-based and faith-based organizations with over $10 million worth of grant funds to conduct tobacco prevention and outreach activities.
Wow, that's amazing. So you also have faith-based organizations helping with tobacco prevention?
We do.
How does that work?
I think the same way of a community-based organization, but a lot of times in the faith-based organizations, you might have a prominent leader who's in the church who is really spreading messages of education to their congregants about, you know, why they should not use tobacco or what are the harms, how it's harmful to your health. And as you probably know, in the African American community, prominent leaders of the church, what they say carries a lot of weight.
Absolutely.
So there are a lot of programs that kind of model that, where they have those messages of importance around health that come directly from maybe the pastor himself, or if they have a health ministry, but someone of prominence in the church. Yeah.
Okay. And I mentioned earlier in our broadcast that the Youth Services Bureau is a part of this program as well.
Yes.
And we focus mostly with teenagers and children. Do you know how many teens and you know, younger kids are involved throughout the county, or how many the Maryland Center serves?
Well, over the years, it's been hundreds of thousands, because in our funding, community-based organizations such as yours, many of them have a focus on educating the youth. So we also here at the Maryland Center have a tobacco ambassador program. It's called the Teen Tobacco Prevention Ambassador Program, where we work in partnership with the Prince George's County Health Department, Prince George's County Public Schools. And we have high school students that come here to the university once a week for 4 weeks, and we provide them training on best practices around outreach, education, and prevention messages, as well as advocacy. And at the conclusion of the training, the students then go back to their respective schools and they do messaging for their peers. And so it's really a great program.
That sounds awesome.
Yeah.
Wow, so these teenagers get an opportunity to learn and then pretty much teach what they've learned here at Bowie State University.
Yeah.
That's amazing. So what was the original goal of the program, and has that goal changed over the years?
Okay, so the original goal was to provide prevention, education, messages, outreach to counteract the targeted marketing of the tobacco companies. And I would like to think that it's really that goal's been exceeded, and that in the state of Maryland now we have some of the lowest tobacco-related cancer rates and teen smoking rates.
Wow.
Yeah.
Wow, that is really impressive. And you've been able to see this happening over the past
years,
18 years or so. That's really amazing. So I know that's really rewarding for you.
It is.
Would you say that's the most rewarding part of the program for you, or is there something else?
I think that is the most rewarding, knowing that your work and your efforts have played a role in, making a difference in reducing those rates, which is really, really important.
Yeah. What's been most challenging for you?
I'd say one of the most challenging things with the Cigarette Restitution Fund, or CRFP, the original focus was singularly on tobacco prevention, and so while that's really important, a lot of times the people that you're working with might not think it's as important because they're experiencing other health issues. So in 2010, the CRFP expanded to include all health disparities, which I think was an amazing move because so many of the health indicators that impact the community can be related to tobacco use, such as cardiovascular disease. Obviously, cancer is one, and lung disease as well. Well,
I can't let you go without asking you about the prevention, a little bit more about the prevention, well, not even prevention, but quitting piece. So, I found that there are some teenagers whom we've worked with who have no intention of quitting. A parent brings them in and is asking for help. What advice can you give for parents and spouses who really want to help their family member stop smoking?
Okay. So I think the first bit of advice would be to acknowledge and recognize that addiction to nicotine is just that. It's an addiction. It's not unlike being addicted to any illicit drugs. And I think the perception is because it's so available, we can go to the store, we can buy cigarettes, that a person should just be able to just quit the habit. And it's not that easy. So I think working to raise awareness about the negative, harmful effects of tobacco use to that individual. Also, the effects of secondhand smoke to the family members. Third-hand smoke in terms of the residual tobacco elements being on clothes or furniture and things like that. So I think with more awareness, people can start to see why it's not just bad maybe for them, but also for other people around them whom they love. In addition, they could provide information about free resources that are available. The state of Maryland has a Quit line that provides free services over the telephone, also web-based services that residents are able to use, and in some cases tobacco cessation aids may be made available. Those aids are also available here in Prince George's County through the Health Department, Tobacco Control Department. But the Maryland Quit line information is 1-800-QUIT-NOW.
1-800-QUIT-NOW. Okay.
And the website is smokingstophere.com.
Stop here. Smokingstophere.com.
Yes.
Okay.
For web-based services.
Great.
Yes.
Great. I wasn't aware that there was a Maryland Quit line.
Yes.
And so thank you so much for sharing that information as well.
You're very welcome.
For our viewers. What about e-cigarettes? Is that, some people think that that's a way to stop.
I think the big thing with e-cigarettes, one of the dangerous things are the battery cartridges. So we're seeing more and more incidents where they're exploding. So they could be very dangerous in that manner.
Right.
But again, we don't know necessarily what's in those cartridges. We think it's nicotine or we think it's just flavored things, but we're not really aware, and then we don't know what the long-term effects are. So while they may be helpful in some regard because you're not as exposed to the other chemicals that are in cigarettes, there's still a lot unknown.
Yeah, yeah. Well, what's your vision for the future of the program?
So ideally, and this is, if we were in an ideal world, it would be to eradicate all the harmful effects of tobacco.
Yeah.
But I think in the meantime, it is to investigate more about what are the potential long-term effects of e-cigarettes and hookah and vaping. So
yeah,
that would be something I'm very interested in working on. Yeah.
Is there anything that you'd like our viewers to know that we haven't covered already?
Well, I would like to just share a little bit of information because I know this is a mental health moment.
Yeah.
And as you probably have seen some commercials around providing information on big tobacco or tobacco companies and how they target mental health institutions and the mentally ill population. So I think it's important to raise awareness about this. They're very strategic in that they'll do a few things. They might provide funding to organizations who provide services to the mentally ill. They provide free or reduced cost cigarettes to mental health facilities.
Yeah.
And then they're working to stop efforts to make mental health facilities smoke-free environments. So, awareness is the key.
Absolutely.
It's really important. And the mentally ill or people who use substances are more likely to use cigarettes than adults who don't. And it can lead to some of those health indicators that I mentioned earlier at higher rates, cancer, cardiovascular disease, and lung disease. And they might die at higher rates as well from these illnesses. Two other things, smoking, the nicotine kind of masks some of the symptoms of mental illness, and so people might feel like they're doing a lot better than they really are in that regard.
Yeah.
And then lastly, it can sometimes counteract or interact with some of the medications that they might be taking. So
yeah, that's right.
I think it's important because they are also a vulnerable population. So,
that's true. That's true.
We need to work to make sure that they're protected as well.
Well, Dr. Ramos, thank you so much for your time.
Well, thank you for having me.
Yeah,
this
absolutely.
was very nice.
And we want to say thank you to you and your team for all of the great work that you're doing in our community, and just keep on doing this great work.
We'll do our best to try, and we are proud to have you as our partner.
Thank you.
Yes.
Thank you. And we're proud to be a partner.
Yes.
We hope you found the interview interesting and educational. Please be sure to reach out to Dr. Ramos and her team or the Youth Services Bureau for more information about tobacco education and prevention. When you're ready to quit smoking, or you know someone who is, the Prince George's County Health Department has products and information that may make quitting easier. Stay tuned for future mental health moments where we'll discuss our new substance abuse treatment and recovery plan, our new building located at 6421 Atwood Street, and more information about how we want to serve you. Know that your mental health is just as important as your physical health. Ignore the stigma and let us serve you and your family. If your child, teen, or family could use a little help finding harmony or balance along the journey, or if you'd like to partner with us in service, call the Youth Services Bureau. And remember, children's mental health matters.